Hello, everyone. My name is Jody Shanoff, and I'm pleased to be your host tonight for this important update from Durham Region. This session has been organized by the region to address questions and concerns about the COVID-19 pandemic and to inform the public about what the region is doing to protect your health and safety. We will also answer questions received via telephone and online. Joining me this evening is Regional Chair John Henry, along with a group of panelists, including the region's CAO, Medical Officer of Health Dr. Robert Kyle, Police Chief Paul Martin, Deputy Chief Paramedics Jim Moyer, and members of Durham's senior leadership team. These professionals have made themselves available tonight to answer your questions. Before we hear more from our speakers, let me start by explaining how a virtual town hall works. Right now, residents from all over Durham Region are answering their phones and connecting to the discussion. We will hear from the regional chair shortly, who will introduce our full panel and give opening remarks. After that, it will be your turn. You will have a chance to ask your questions to our panel of experts and to raise issues that you think are critical at this time. You can get in line to ask a question at any time by pressing *3 on your phone keypad. You'll then be put through to an operator who will take down your question and put you in line. For those of you joining us online, please type your question into the question field. Your questions will be read out loud by me, the moderator. If you have a question about issues discussed during tonight's COVID-19 information session, but don't get a chance to ask it during our call, you may find updates online. For information related to COVID-19, please visit durham.ca. Our emphasis tonight will be on providing important updates and hearing from residents who want to speak directly to regional officials. Here are a few things to keep in mind when you ask a question tonight. When using your phone to ask a question, press *3 on your keypad and you'll be routed to an operator who will ask you to provide your name and the nature of your question. Please try to keep your question as brief as possible. There are a lot of people on the line, and we want to try to get to as many of your questions as we can. Please ensure your question is related to COVID-19 and how the region and health officials are working to protect residents. Again, my name is Jody Shanoff, and I'm pleased to be your moderator for this virtual town hall with Durham Region Chair John Henry, staff from the region, and public health officials. It's my job to keep this conversation moving smoothly and to make sure we get to hear your questions and have as much discussion as possible. Before we start getting to your questions, I'd like to invite the chair and members of our panel to say a few words. Chair Henry, what would you like Durham Region residents to know about the work happening to protect residents and businesses of the region during this pandemic?
Well, good evening, and thank you for joining us tonight for this virtual town hall. Tonight we are joined by several members of our senior leadership team, and I'm pleased to welcome our Chief Administrative Officer, Elaine Baxter-Trahair. Elaine will be saying a few words shortly. We're also joined by Dr. Robert Kyle, the Medical Officer of Health, and Pepi McTavish, our Associate Medical Officer of Health. During a situation such as this, we rely on our past experiences to help us make the best possible decisions. To that point, we are so fortunate to have someone as experienced as Dr. Kyle on our team. We look forward to hearing him tonight. In addition, tonight we are joined by Paul Martin, Chief of Durham Regional Police, Jim Moyer, Deputy Chief of Durham Paramedic Services, Don Beaton, Commissioner of Corporate Services, Stella Danis Papaconstantino, Commissioner of Social Services, Susan Siopas, Commissioner of Works, Nancy Taylor, Commissioner of Finance, Bill Holmes, General Manager of Durham Transit, Brian Bridgman, Commissioner of Planning and Economic Development, Simon Gill, Director of Economic Development, James Kilgore, Director of Emergency Management. Whether you're joining us by telephone, listening online, or taking part through the Rogers TV broadcast, we are glad to have you with us tonight. Remember, we want to hear from you because tonight is about you, so please join the conversation. Take a moment to submit a question, whether it's via phone or online, because we're here to help you and provide you with the information you need. Over the past several weeks, Durham Region has shown what it means to be in this together. Your efforts have been inspiring. You've stayed home, practiced physical distancing, efforts that have helped protect the health and welfare of our communities. We know that this is a difficult time, and we as a region are looking at various ways to help. We're waiving transit fares at this time. We have created free emergency childcare spots for our frontline workers and essential workers. And for those of you who need a little extra time, we have suspended all water and sewer bill late payment charges, collection notification, and water shutoffs for non-payment. We are working to take care of our vulnerable communities by coordinating emergency support for unsheltered residents and offering access to emergency assistance under Ontario Works. We also understand that it is in these very unpredictable and difficult time for our business community. We all miss shopping in our local stores, shopping in our downtowns that have been the heart of our communities for years. I can assure you that the Durham Economic Development Task Force is working to deliver urgently needed support and resources to our business community. This team of local economic development experts are advocating on behalf of our local business owners, working to make sure that their concerns are addressed and actioned. Durham Region is one of the most vibrant, innovative, and diverse communities within the province of Ontario. And together, we're proving that. We intend to keep it that way. And before I pass it on to Elaine to provide some remarks, I want to express my most sincere thanks to all of our frontline workers. You are all true heroes. You have shown us all how to be Durham strong, and I couldn't be more proud of each and every one of you. On behalf of everyone here in the region, thank you for everything that you've done and continue to do to keep us safe and navigate this unprecedented situation. Thank you. And now I'd like to ask our CAO, Elaine Baxter-Trahair, to say a few words.
Thank you very much, Chair Henry. Thank you for taking the time to join us tonight. Along with myself and Chair Henry, our Durham Regional Senior Leadership Team is happy to answer your questions and provide you with information as we face this challenging time together. Navigating a pandemic is something that we've never done before. It's a once-in-a-lifetime situation that has unfortunately impacted and changed the lives of everyone. I would like to start by thanking everybody for doing their best part to keep our community safe. I know it's been difficult. We've been asked to stay 6 feet apart and to use technology to keep in touch with friends and loved ones. And while this has been a difficult time, it has been incredible to see the overwhelming display of our strong community spirit. Believe me, our frontline and healthcare workers really appreciate the support you have shown. They know you are standing behind them. Throughout this situation, one thing has remained consistent. The health and safety of our residents has and will continue to be our number one priority. Over the past few weeks, our employees have worked around the clock to maintain essential services, those that directly impact the lives of our community members. Our employees are responsible for public health, long-term care, social services, emergency child care, water and sewer, and more. We have frontline workers such as paramedics, police officers, and transit employees. And we have crews maintaining our roads, bridges, and traffic signals to ensure they remain safe, and solid waste staff processing increased volumes of waste. We are incredibly proud of our employees and that they have continued to provide those essential services that directly impact the daily lives of our community members. It is our employees who have worked in partnership with a diverse assortment of local not-for-profit agencies to provide valued support to vulnerable residents, because we want to make sure they too have the support they need to make it through this difficult time. We are getting through this together, and the region will be stronger because of it. Once again, thank you for taking the time to join us tonight, and I would now like to turn this over to Dr. Robert Kyle, the Medical Officer of Health for Durham Region, who will provide an update on COVID-19 in the region.
Thank you, Elaine, and welcome everybody. I'm pleased to be here tonight and to do my part to answer your questions. For those who haven't discovered our web resources, I would urge you to go to durham.ca/NovelCoronavirus. On that page, there is resources and tools for you, the public, but also for healthcare professionals, school community, and our other partners. In particular, I would urge you to go to durham.ca/COVID cases to get the latest on the number of cases of COVID-19 in Durham Region by municipality. If you haven't gone to that website recently, we've added more functionality so you can get more information about cases, in particular in long-term care homes and retirement homes. Currently, we have about 750 cases in Durham Region, and we have about 12 outbreaks on the go. Having said that, I think it's important, and to underscore what you've heard from Chair Henry and the CAO, that COVID-19 is a journey. It's not a sprint. We all have a part to play in terms of flattening the curve and decreasing the demand on our hospitals and acute care system. I think we're making a difference, but we have a ways to go, particularly with respect to long-term care homes and retirement homes. So I want to thank you all for doing your part with respect to physical distancing, social distancing, and we all appreciate the sacrifices that you and your families have made to overcome this pandemic. We will get there. It will take some time. It is a journey. It's not a sprint. And with that, I'll turn it back to the moderator who will proceed with your questions. Thank you.
Thank you, Dr. Kyle. For those of you just joining us, my name is Jody Shanoff, and I'm your moderator for this evening's virtual town hall. I'm pleased to be here with Region of Durham Chair John Henry, staff from the region, and local health officials to discuss the measures in place to control the spread of COVID-19. Just a reminder, you can press *3 on your phone keypad at any time to get in line to ask a question. We're going to go to our first question that came to us online, and the question is the following. It's a tough time in our region. People are scared and are really struggling. How is Durham supporting residents during this unprecedented time? How do you think we will bounce back after it's all over?
I'll direct that question to the Commissioner of Finance, Nancy.
Thank you, Chair Henry. There's a couple of steps that we've taken from a finance perspective, one of which is we have suspended all water and sewer bill late payment charges. And in conjunction with that, we've suspended collection notifications and water shutoff for non-payment, so nobody will have their water shut off for not being able to pay their water bill. We've also partnered with all the local municipalities across the region, and we are essentially having a grace period for interest and penalties on property taxes, again, to buy some time to get us through this journey that Dr. Kyle was referencing. And we've also instituted free transit.
And Simon, for economic development?
Yes, thanks, Chair. So bouncing back, we formed an economic task force with our area municipalities, the BIAs, chambers and boards, and small business center, and we're all working together to provide businesses with the support and info that they need right now. And we're also working together on a recovery strategy. Now, the recovery strategy is focused on making sure that our economy bounces back when we eventually start to emerge from this by advocating for the needs of businesses, guiding them through accessing support, and providing small businesses that are still operational and offering safe pickup or delivery. And I'll just add that the recovery strategy that's in development is also going to address and include social issues, not just economic recovery.
Thank you.
Thank you very much for those responses. Our next question comes to us live from Rose. Rose has a question about PSWs and being in public spaces. Rose, what's your question? Hi, Rose. Are you with us? What's your question this evening? Seem to be having difficulty hearing from Rose. I will try to paraphrase Rose's question.
Yes.
She was at... Are you there, Rose? Sorry, Rose's question was about PSWs.
Yeah, no, what I would like to know, they're doing a wonderful job, don't get me wrong, but what I'd like to know is why is it that some of them wear their uniform in public spaces like the supermarket, the bus, instead of when they finish work, changing to their regular clothing and then go to the next job? Because I think...
Okay, thank you for the question. Dr. Kyle?
Yes, so I can't speak to any specific circumstances, but clearly, if a PSW has completed their shift, and depending on the patients that they have cared for or clients they've cared for, and the circumstances in the home in terms of is there COVID-19, et cetera, then clearly they should, when they're finished their shift, go straight home, change their clothes, and practice good hygiene. In terms of if they're seen in public with their clothes, their work clothes on, I can't comment on the circumstances. Perhaps a worker is on the way to work as opposed to finishing work. But generally speaking, work clothes should stay in the workplace. And when a shift is completed, it's just good hygienic practice to go straight home, change your clothes, have a shower, that sort of thing, and make sure that hygiene is practiced at home at all times. Chair, that's about as far as I can go with this question. I could direct it to my associate if she has any other comments, or we could go on to other questions.
I think we'll go on to the next question.
Okay.
Next question comes to us live from Jim, and Jim has questions about social distancing. Jim, what's your question?
Hello?
Good
I'm
evening.
assuming that you're talking about me.
Yes.
I have witnessed physical distancing in my neighborhood and people that are not practicing it. And my question really is, what, if anything, is the region or police prepared to do if such things are observed? Thank you.
Thank you. Chief Martin?
Yeah, thank you, Mr. Chair. Thanks for the question. With respect to physical distancing, we don't have a bylaw like, for instance, Peel Region or Toronto does. So being within 6 feet is not against the law here in Durham Region. What we do have is we're dealing with the Emergency Measures and Civil Protection Act, which basically says at this point in time, as the province enacted it, is that if people gather as 5 people or more than 5 people, if businesses that are not deemed essential are operating, then we will enforce the Emergency Measures Act. So we have established on our www.drps.ca online reporting, people can go there and report these types of incidents where there's gatherings of more than 5 people. If they're disobeying the closed parks, those types of things, and if businesses are operating that shouldn't be operating. The other thing that people can do is go to our non-emergency line at 1-905-579-1520, extension 5802, and they can leave a message. We've had about 1,300 calls so far since the Emergency Act was proclaimed, and we've cleared about 75% of those calls up to this point, and we continue to clear them as we speak. So I would suggest that people can certainly call us if they see those types of infractions, but as far as people within 6 feet, that's not specifically prohibited under the Emergency Measures Act, and we don't have a bylaw either. Thank you.
Thank you very much for that. Our next question comes to us from Sandra. Sandra's got a question about long-term care facilities. Sandra, what's your question? Sandra, do you have a question for us this evening? Since we're having trouble connecting with Sandra, I will ask the chair to address what the region is doing to help long-term care and retirement facilities.
So I will move that to our Commissioner of Social Services, Stella.
Thank you, Chair. In the region, we have 4 regionally owned long-term care homes. We have Lakeview, Fairview Lodge, Hillsdale Terraces, and Hillsdale Estates. I'll be able to speak to our 4 homes this evening. Our long-term care division follows the directives of the Ministry of Health and Long-Term Care, and we work especially close with Durham Public Health. We have active screening at our homes for our staff. What this means is when our staff arrive in our homes, the temperature is taken, and they're asked a number of questions to determine if they are suitable to come into work. And if they are provided with a mask and they carry on with their day. Upon leaving their workplace, they are screened yet again, their temperature is taken again, and asked questions again, and they leave to go off on their day. We also, as of March 19th, we stopped permitting our staff from working at any other assigned home. Staff are provided with their personal protective equipment, as I mentioned earlier, and depending on where they work in the long-term care home, it might be somewhat different. We follow infection prevention and control procedures, and we also, when we are in an outbreak, we isolate our residents, and isolation means that they stay in their rooms, including having meal times. Our staff practice social distancing throughout the day as much as possible, except when they're caring for the resident, in which case they wear their personal protective equipment and take care to provide that distancing when it's safe to do so. Thank you, Chair.
Thank you. Could we have the next question, please?
Yes, thank you. Our next questioner live on the phone is Deborah, and Deborah's got a question about small businesses. Deborah, go ahead.
Thank you, Mr. Chair, and thank you to the panel for this call today. Many small businesses, we hear the messaging that this is going to be a journey and not a sprint. I think a difficulty that everyone is having is how to plan. People have laid off staff. Many businesses don't qualify for loans, don't qualify for wage subsidies. They're in crisis. Given now as of the messaging that we're getting today, we're looking at the end of May. We see all around us parks and different things being closed for the season. Kawartha Lakes Conservation Authority announced all their scheduling is canceled for the year now for the full summer. When this type of messaging is heard, but there's no clear guidelines or parameters given for what the journey looks like, people need to be able to put plans in place. If they only have so much savings, they need to know, how to plan before they declare bankruptcy, before they sell, before they, or can they still hold on? Is there any way, is the region aware of any kind of timeline? Is there anything that can be communicated to the province to somehow tell small businesses what kind of planning we can do in this journey so that we can somehow put some sort of mitigation measures in place to try to survive this pandemic? Thank you.
Yes, thanks. Simon Gill here. I can field that. Thank you very much for the question. So I'll talk about the impacts on small business first. And we recognize, of course, that the impacts on small business being felt by COVID-19 are severe. And we're working with the Economic Development Task Force to support small and medium and large-sized businesses. It was actually the first thing we did to help local businesses was form the task force with area municipalities, BIAs, chambers and boards, and the Small Business Center. one thing we did was we surveyed the business community. We got over 1,000 responses to understand what those impacts were, what the needs were. And at the same time, we immediately set up a centralized website where businesses can go for information about all the various financial supports available from the federal government, the province, the region, and the cities and towns. That website is durham.ca/COVID response. And of course, we also immediately started advocating on behalf of small businesses in the region. Our regional chairs hosted calls with MPs and MPPs. He's written letters, and we've been sharing the impacts on businesses with the Premier and with the Prime Minister, particularly stressing the urgency and the need for help. And the Economic Task Force has actually been doing a lot more to support businesses, running local promotional campaigns, organizing and promoting webinars, offering direct one-on-one support, and we recognize that the path out of this is very unclear at the moment, but we are working on a recovery strategy, and we're working with all of our stakeholders and across the region with our area municipalities to figure out a way to get through this together. Thanks.
Very much for that. Our next question comes to us online. It's from Dan, and Dan asks the following. Why were PSWs who were at several locations and with patients in the community not checked upon entry into the homes every time they came to work?
I will pass that question on to Dr. Kyle.
Thank you for the question, Dan. I guess the answer depends on at what point in time you were observing this behavior. As you heard from the Commissioner of Social Services, active screening has been put in place, restricting visitation to just essential visitors, etc. And more recently, either a directive or emergency order has been put in place to restrict PSWs and other healthcare workers working at more than one site with respect to a long-term care home or retirement home. That is fairly recent. Why did it take so long? I'm not at the central command table. There are a lot of decisions that they have to make, and I think it depends on our experience. It depends on what's happening on the ground in long-term care homes and retirement homes as to the rules that were put in place. And as more and more cases were occurring in the homes, despite the best efforts to restrict visitation, active screening, and so forth, more and more additional measures were put in place. And as your question focuses on, including having workers only work at one site. I should add, too, that I believe this has been in place for at least a couple of weeks, if not longer, in the region's long-term care homes. Thank you.
Dr. Kyle. Just a reminder to people who are joining us for this evening's telephone town hall, if you have a question of Chair Henry, Dr. Kyle, or any of the other panelists who are on our call tonight, you can dial *3 on your telephone keypad where you can queue and prepare to ask a question live of our panel. If you're joining us online, there is a question field on your screen where you can type in a question if you have one that you'd like to pose to the panel. Our next question comes to us live from Jennifer. Jennifer's got a question about COVID-19 and animals. Jennifer, go ahead with your question.
Yes, hi. I have a concern regarding the human-to-animal contagion that has been proven or has been at least stated in the news. I have noticed, since I'm home all day, that there's an influx of wild animals, in particular raccoons, running around and across my fences in the backyard during the day, which is really where I'm concerned, because typically they're a nighttime animal. Should I be concerned?
So is that directed at me? It's Dr. Kyle here. If it is, there's no evidence that raccoons or other animals in particular are contributing to community transmission in Ontario or indeed Canada. Transmission is occurring by droplet spread from person to person. When the pandemic first started in China, it is believed that coronavirus, which was circulating among the bird population in particular, and in particular at live markets where there was very intimate contact between humans and birds, the virus was able to be transmitted from birds to humans. But the pandemic is being spread by person-to-person contact now. And so if your concern is that the wild raccoon or other animal population is contributing to this, there's absolutely no evidence to suggest that's happening. Thank you for your question.
Thank you for that, Dr. Kyle. Our next question came to us online. The question is, how is the region protecting paramedics? What type of precautions are in place, and is there enough PPE?
So thank you for the question. Deputy Chief Jim, could you answer that, please?
Yes, thank you, Chair, and thank you for the question. First, I just want to take a quick moment to say how very proud we are of the frontline paramedics, and a big thank you for the work that they're doing day in and day out, particularly during this very difficult time. Paramedics are often the first point of contact for medical care in our community, and the health and safety of our paramedics is paramount. We have put protocols in place to ensure paramedics are triaged and risk assessed at several different points along the continuum of care. Medics, by virtue of their education and training, are versed in dealing with infectious disease of most kinds, and while COVID-19 is new, paramedics keeping patients and themselves safe is not. We have been engaged with provincial partners to receive ongoing updates and ensure new medical directives, protocols, and best practices are implemented with the goal of minimizing exposure to respiratory droplets and risk of infection. New protocols regarding screening, treatment, PPE, and transportation have been implemented across our DPS, and paramedics have been educated and trained on the changes in response to COVID-19. So we're in pretty good shape.
Thank you very much for that. Just a reminder to people who are listening on the call tonight, if you have a question you to pose of the panel, please dial *3 on your keypad. You'll be put into a queue and have the opportunity to ask your question live. Residents who are listening to us online, there is a question field on your screen, and you should feel free to type in a question there that will also be put into the queue. Our next question comes to us live from Sam, and Sam has a question about the homeless in Durham Region. Sam, go ahead with your question, please.
Hi, good evening to each and every one. Thank you for taking the question. My question is, what are the stats on the homeless, the needs, and, is there anything being done to meet their needs in terms of their stay, food, and also about the, food situation for them and for others who are in need of food? And the third question related to that is, if the community wants to help or people want to help, is there any way that they can either contribute by giving or even in person if there is a way to do some kind of help?
Okay. Thank you for the question. On part of that, if you're looking to make a donation, an online donation to any one of our charities in the region. For example, Feed the Need, who looks after our food banks, would be a great way to help our residents. For the other part of the question, I'm going to go to our Commissioner of Social Services, Stella.
Good evening. Thank you, Chair, and thank you for the question, Sam. The Region of Durham is actively coordinating the COVID-19 response for our unsheltered residents by enhancing the shelter system to provide more support to those who are at risk. We've extended funding for our overnight warming centers to increase and maintain the capacity of the shelter system. We're working with our current shelter operators and our health department to ensure that staff are doing everything they can to prevent the spread of COVID-19 and support the clients who have these symptoms. We've secured hotel partnerships to expand capacity at the shelter system to ensure distancing, isolation of at-risk clients, and isolation of clients pending test results. We're securing a large facility to support the shelter system's COVID-19 response. We're also working with our community partners to coordinate resources to ensure unsheltered residents can access washroom facilities, food security, shelter, and outreach support. Part of our COVID-19 homelessness funding will be put into a COVID-19 Community Assistance Fund, which has actually been released as of today, and information is on our website. This is available as a one-time allocation for nonprofit organizations in Durham Region that are providing urgent help to vulnerable residents, homeless residents, and residents at risk of homelessness impacted by the COVID-19 pandemic. And this information, as I said, an application is available on the region's website. In addition, Sam, if you check our website, you'll see a community resources page that has a list of amazing resources in our community to support everyone, including those residents who are unsheltered at this time. Thank you.
Thank you.
Thank you very much
Next
for that
question,
response.
Please.
Yes, our next question comes to us live from Rosemary. Rosemary's got a question about bus drivers in the region. Rosemary, go ahead with your question, please.
Yeah, hi. I'm just wondering what kind of protection is available to the bus drivers? People coming on the bus driver where he sits up front is completely open. Is there any intention that the bus driver could have some kind of protective shield between him and passengers coming on the bus? That way it would give him the opportunity to avoid contracting this disease and carrying it home to his or her family. I mean, I'm originally from Britain, and for many years the bus drivers have had a shield between them and the passengers coming on the bus. I mean, there's a speaker that the driver can talk to passengers as they come on and answer questions, but they're completely shielded from the passengers. So is there any plan to put something like that in action here for our bus drivers?
Thank you, Rosemary. I'll ask Bill Holmes, our General Manager of Transit, to respond.
Thank you very much. We do have a plan for installing safety shields on all of our buses, and that will be happening over the next year to 2 years. But in the meantime, when one of our first actions that we took on the 19th of March was to ensure that our bus operators were safe as they were operating the bus. And we implemented the rear door boarding process, so all customers now board through the rear door. We also sectioned off the bus so that the back 2/3 of the vehicle are for customers only. And at the same time, we implemented and waived having to pay a fare so that customers did not have to come up to the front of the bus. And that, again, maintained that physical distancing between our operators and the customers. On our specialized services side, we have since, and today we have supplied those operators with a full suite of personal protective equipment, which includes gloves, a mask, and a face shield. Thank you very much for your question.
Very much. Our next question comes to us online. It's from Joanne, and Joanne asks, how quickly will there be more support and experts at the nursing home in Pickering that has reported the 33 deaths?
Thank you. I will pass that question on to Dr. Kyle.
Thank you for the question. Yesterday, I issued an order to Lake Ridge Health and to Orchard Villa, and the gist of the order was to have Lake Ridge Health do an assessment and develop basically an action plan to provide assistance to Orchard Villa with respect to infection prevention and control, and with respect to the clinical aspects of the home. And the order also required Orchard Villa to comply with the advice, assessment, and recommendations of Lake Ridge Health. I'm aware that Lake Ridge Health, a team from Lake Ridge Health, went to Orchard Villa today. I believe that an assessment was done, and I believe an action plan is being developed as we speak. I don't have the specifics with respect to, in particular, if there's additional staffing that is required. I don't have the specifics as to how that would look, but Orchard Villa is of immediate importance locally. Lake Ridge Health, Orchard Villa, the Central East Lynn, they're all on top of this file. And earlier today, the province issued a news release that indicated that quite a number of additional supports are being put in place, and including in that is a call to the federal government for assistance. So the decisions as to who goes where, et cetera, are made either at higher levels or, in the case of Orchard Villa, between Lake Ridge Health and Orchard Villa. But I'm confident that both parties are working on this as quickly and as effectively as possible, and hopefully the assistance that is required and the other recommendations that fall from the assessment will be implemented as quickly as possible. Thank you for the question.
Very much. A reminder to our listeners, if you've got a question of Chair Henry or any of our panelists joining us tonight on this call, you can dial *3 on your phone keypad, where you'll queue and have a chance to ask your question live. Participants joining us on the online audio stream, there is a question field on your screen where you can type in a question if you have one that you'd like me to pose to the panel on your behalf. Our next question comes to us live. It's from Paul, and Paul has a question about the reopening of regional services after the pandemic passes. Paul, go ahead with your question, please.
Yeah, hi. I'd like to know, when does the panel have any idea of, is there a tentative date of when they're going to start reopening Durham, and then what type of phases? Like, is it going to be like business, civil, government? Have they got any strategy for this? Because I worry about the long term of being closed down like this for our economic prosperity down the road, leading to our future that way, because the longer it's closed down, I understand we have to keep it closed down until we get the virus in control, but eventually they're going to have to look into reopening because of the economics of it all and those things. Does the panel have any ideas? Is there a long-term strategy for this, or?
So, excellent question. It's John Henry, the chair of the region. Yesterday, we met with the mayors and chairs of the greater Toronto-Hamilton area in a conference call, and this was a very part of that question. We're working with the province and trying to find a time when we can do this, and it has to be collective. Not one municipality can open up and leave others closed. It just means moving people in different ways. So there's great concern about doing this in an effective and an orderly manner so that we can continue to flatten the curve. And now I'd like to ask our CAO to talk about what services are open at the region, and it is still business here as usual, just doing it in a very different way. Elaine?
Thank you very much, Chair. In terms of when the region will be back to normal practices, that will really depend on when the province begins to lift the emergency orders, which we understand will be done very incrementally. That being said, the region is continuing to provide all of the essential services that it does provide. A number of staff, over 1,000 actually, are doing that from home. Others are on the ground and on the front lines, as I mentioned at the outset. This includes our transit workers, our Durham public health workers, social services staff, solid waste management staff. Across the board, all of these workers are required and are on the front lines. With that respect, we are taking care to ensure we use social distancing. We also have a robust recovery framework that we're putting into place that will address the community needs at a social level to ensure that we're addressing community health and safety, the built infrastructure to ensure that we're advancing infrastructure projects which will help put people back to work, the economic framework which will assist small, medium and large businesses get back up and running as a result of this. And the fourth leg in that is looking at how the region itself will get business back to normal. But again, we do anticipate this being done over an extended period of time.
Thank you very much for that response. Our next question comes to us online, and this Durham resident asks, I've seen groups of people, more than 5, who are getting together. Is that illegal, and how do we report this?
Thank you. I'll ask Chief Martin to respond, please.
Yeah, thank you, Mr. Chair, and thank you for the question. The short answer is yes, it could be illegal. Any groups over 5 are considered illegal unless they are of the same family and living under the same roof or at the same residence. So with respect to that, if people are seeing groups of 5 people congregating, or if they're playing on playgrounds, those types of things, they should contact us, and there's a couple of ways of doing that. One way is online through our website, www.drps.ca, under our online services, and we can take a report that way. Or you can contact our non-emergency line at 1-888 or 1905-579-1520, 1520, extension 5802, and leave a message, and we will respond to that. We've received about 1,300 calls or so since the beginning of this emergency order, and we are responding to about 50, 60, sometimes more a day. But please let us know, and we'll certainly try to educate people, and if necessary, we will enforce the law. Thank you.
Thank you very much. Our next call comes to us live. It's Christina, and Christina's got a question about travel. Christina, go ahead with your question, please.
Hi there. Thank you, Ms. Chair, and thank you, the panel. Are you guys asking people traveling from different provinces to self-quarantine and when they come to Ontario?
Thank you for the question, Christina. I'll turn it over to our CAO, Elaine, please.
Thank you, Chair. Thank you for the question. I can respond to that from the perspective of the region of Durham as a government. And when our employees do travel outside of the province, we do require when they come back that they do 2 weeks of self-isolation and that they do return to work when they are symptom-free at the end of that 2 weeks.
Thank you very much for that. Our next question comes to us online from Allison. Allison asks, do we know how many cases of confirmed COVID-19 are in the region?
Dr. Kyle, could you respond, please?
Yes, thank you for the question. Again, if the questioner goes to durham.ca/COVID cases, that will take them to our data tracker. What that does is present the cases, by the region as a whole, by municipality, and it describes the cases that are in home isolation, those that are in ICU, unfortunately those who have deceased, And you can also get information by age and by gender for cases as a whole, or in particular by affected long-term care home and retirement home. I believe that we're just about 750 or so cases as of the time of day that the tracker was updated today. It was earlier today. And we also have 12 long-term care homes or retirement homes in outbreak. So it's a terrific resource, and I would urge the questioner to browse. Again, durham.ca/COVID cases. Thanks for the question.
Thank you very much. Our next question is live. It's from Larry, and Larry's got a question about how many times a person can get COVID-19. Larry, go ahead with your question, please.
Yeah, I was just wondering if you've had COVID-19 once, can you get it again?
Dr. Kyle, could you respond, please?
Chair, if I may, maybe I can have Dr. McTavish speak to this question, please.
Okay, Dr. McTavish.
Sure, thanks. Thanks, Larry, for the question. So that's a great question, and I'll have to say that we don't know yet. So we don't know if people can get COVID-19 and then become immune, sometimes like you can with other seasonal coronaviruses. So we don't know that yet. We don't know if people can get it and then get sick again. We've seen some research out of the countries who were earlier affected where people thought they had immunity and then perhaps they got sick again. So it's a great question, and I'll say that right now we don't know, and we're waiting as the disease progresses and the research progresses. Hopefully we will have a better idea. So that's all I can say for now, unless Dr. Kyle wants to weigh in. Thank you for the question, though, Larry.
I'm going to go to our next question. That question came to us online. It's from Julia, and Julia asks, how is Durham Region supporting long-term care facilities and its residents in terms of medical care and protection against further outbreaks of the COVID-19 virus? What is the short-term and long-term plan to provide additional support beyond basic physical needs?
Thank you for the question. I will pass the question on to Commissioner of Social Services. Stella, please.
Yes, thank you for the question. Thank you, Chair. In the region, we operate 4 long-term care homes, Lakeview Manor, Fairview Lodge, Hillsdale Terraces, and Hillsdale Estates. We follow the directives of the Ministry of Health and Long-Term Care, as well as working closely with Durham Public Health Department. Before the outbreak became the COVID outbreak became an outbreak, we started to assess staff, screen staff upon entering our long-term care homes. And by March 14th, we were actively screening staff. That means we're taking their temperatures upon entering, and now we take their temperatures when they're leaving as well. We also stopped permitting any visitors to our home as of March 14th. Only essential visitors, which is our staff, who are allowed to attend, and we stopped allowing staff to work at any other healthcare location as of March the 19th. We have very qualified staff in our homes. Each home has a medical doctor, and we have qualified registered nurses, registered practical nurses, and PSWs. In addition to medical care, we also have recreation for our residents. Residents at this time especially can FaceTime and or call their family members. We offer music, we offer games, reading. We've hired actually resident care aides because we no longer have volunteers at this time. They're in the homes working closely and just hanging out with our residents, if I can use such a simple term. Long term, we will take advice from the Ministry of Health, Ministry of Long-Term Care and Public Health to ensure that we continue to meet the needs of our residents in the best way that we can. Thank you.
Very much for that. Our next question comes to us live from Vivian. Vivian's got a question about bus drivers and public transit. Vivian, please go ahead with your question.
Yes. My question is that when I bought the public transport in Durham, here in Oshawa specifically, majority of the time, I'm the only one wearing a mask. Half of the city bus is already roped off for the protection of the bus driver. So we take the rear entrance of the bus to go in the bus, and I felt like, okay, we've been told to give a specific distance, but we park in there like a sardine. There is no breathing space there, because sometimes I get in the bus, I start opening up all the windows because it's so hot. To me, because I do have a little bit background of medical, that bacteria tends to breed, multiply in heat. So I open up the windows, but sometimes I do get being told that it's so cold. But I don't know, what should the bus driver be told how many passengers that he can pick up, and then he doesn't stop for every single stop until we are all packed together like a sardine, because there is...
Thank you. Sorry, Vivian, thank you for your question about public transit. I'm going to hand it over to the chair to answer now.
Thank you. And there's two parts to that question, Vivian. So I will start with the first part, and that relates to how the bus is separated. And we actually have three zones on the bus. There's the rear zone, and you mentioned the barrier that we have, and that's for passengers boarding from the rear of the bus, and that's the vast majority of the passengers who are using the service today. And that barrier is, again, to prevent the passengers from coming to the front of the bus to pay a fare. The second zone in the middle of the bus, that's the area that we reserve for residents who use mobility devices, as well as individuals who have young children in strollers. So that's what that middle area of the bus is. And then the front of the bus is reserved for our bus operator. And each of those zones provides that appropriate physical distancing for people. The second part to the question relates to our bus loading. And we have implemented, as have all the transit agencies throughout the province, restricted loads, which is basically a half load. And our restrictions are a half-seated load, which roughly gets to between 10 to 15 people on a bus, which means that people can spread out when they're on the vehicle. And yes, we do track the loading in real time, and our operators do limit those loads to those maximum levels. Thank you.
Thank you very much for that response. Carrie is next. Carrie's a live caller, and she has a question about the co-op she's living in. Carrie, go ahead with your question, please.
Thank you very much for this opportunity. Yes, I have a concern. I live in a very small community in a co-op, and so social distancing is almost nil. How do I convince people? A lot of people are telling me that it's just a flu, it's like influenza. I have a very low compromised immune system, and it scares me when people come around and, try to tell me this stuff. How do I go about telling them that it's not like that? And how can they tell the difference? How can I tell them the difference between the two or three?
Thank you for the question. Could I ask Dr. Kyle or Pepi to respond, please?
I can start, Chair. I think it depends on whether in your co-op, for example, you're talking about cases who have been tested positive and are in self-isolation. That may not be the case, but let me just say, if that is the case, then in Durham Region, I issued an order several weeks ago that requires persons who are positive for COVID-19 and require self-isolation to do so. At the time we notify cases of their positivity, we also notify them that they are required to self-isolate in accordance with the order. There is a penalty if you do not follow the order, and in accordance with provincial guidelines, we check in by phone on a periodic basis to ensure that self-isolation is occurring. If, in fact, you're talking about more generally people are not respecting physical distancing, social distancing, respiratory etiquette, hand hygiene, those sorts of other messages, that is more difficult. All we can do at our end is provide the public with not only what are the key messages, but also a rationale for why they need to be followed. Our website, durham.ca /NovelCoronavirus, is a good source of information. And if, in fact, you want assistance, and to the extent we can provide it, then I would urge you as well to go to the Durham Health Connection line. However, I should warn you that a lot of that traffic is related to cases and contact management. So there may be a delay in terms of answering your call. So it's really best to go online. But it is a serious issue, and some settings are more difficult to adhere to good, sound public health advice than others. I think that's the best that I can do, Chair, and I thank her for the question.
Thank you very much for that. Our next call comes to us from Derek. Derek's live with us, and he has a question about staffing and water treatment. Derek, go ahead with your question, please.
Yes, thank you for taking my question. I'm hoping the panel can comment on the staffing levels, both short-term and long-term, of our electrical supply, our water supply, and our water treatment plants. Thank you.
Okay, thank you for the question. I will get our Commissioner Works to answer that question. Susan?
Hi, Derek. Thank you for your call. Our water treatment plants and our sewage treatment plants are up and running. They're fully staffed at this time. We've taken precautions to ensure that the workers in the plants remain healthy. We've broadened shifts so that we've have less overlap during the day, less overlap at shift turnovers so that we can ensure that our workers stay healthy, supplied all of the PPE that might be needed there, as we always do. You're probably aware that all of those services that you've mentioned have been deemed essential, so we have them up and running now and see no reason why we wouldn't in the longer term.
Thank you very much for that. Our next caller is Vito. Vito is live with us, and he's got some questions about businesses in Durham Region. Vito, go ahead.
Hi, yes, I own a small landscape business, and moving forward with the weather and the weather changing, I've been able to get all my clients, they all turn them down as up until now. We're not sure what is essential and what's deemed not essential in Durham Region right now. I've turned all my clients away right now, and now with lawn care coming, I'm not sure what I'm supposed to do, but in the meantime, I still notice other landscape companies out there starting to do work. So I just need a clarification on what we can and cannot do in the landscape industry and lawn maintenance industry at this time.
Thank you, Vito, for the question. I will get our Director of Economic Development, Simon Gill, to answer that question for you.
Yes, thank you very much for the question. We're actually hearing a lot confusion over what's essential and what's not essential, and we're advising companies that the best place to go is the province, the provincial website, as they are the governing authority over what is deemed essential and what has been ordered to be closed. And if you go to the Ontario government website, there's a list of essential workplaces, but actually what's much more easier to access is a 1-800 number that they have posted. And so where there is a little bit of ambiguity or a little bit of confusion, what part of my business can I open? Can I offer no contact services, or do I have to close completely? That number is 1-888-444-3659, and that is a Stop the Spread business information line at the province of Ontario, and you'll be able to ask them directly about your business specifically, or any business, and find out what components of it, or whether it has to be closed, or whether it's still deemed essential. Thanks for the question.
Thank you very much for that. Just a reminder to our listeners this evening, if you have a question you'd like to ask of Regional Chair or staff who are on the call with us this evening, you can dial *3 on your keypad, and you'll be put into a queue where you'll have the opportunity to speak live to the panel. We're also accepting questions through the online feed. For those of you listening through your computer, you can use the question window on your screen to submit a question there. Our next call is live from Carol, and Carol has a question about the COVID-19 outbreak. Carol, go ahead with your question, please.
Hi. First of all, I'd like to thank the chair and the panel for all their work during this difficult time. My question is about outbreaks in neighborhoods. In particular, are there some what you consider an outbreak in a neighborhood, or is it more linked to long-term care residence areas?
Thank you for the question, Carol. Dr. Kyle?
Carol, thank you for the question. When we think of outbreaks, we think of, in particular, institutions, and these generally are hospitals, long-term care homes, and retirement homes. Generally, an outbreak is typically more than what is normally expected. It is an assessment that is done by public health, and then that triggers a number of outbreak control measures. In the case of COVID-19, the rules still apply. We're talking about institutions, so hospitals, long-term care homes, retirement homes, but only one case is considered an outbreak, which would then trigger outbreak control measures. You've heard, if you've been on the line, a number of measures that are currently in place with respect to the region's long-term care homes, but it also includes increasing testing and public health measures that would not only try to detect disease, but try to control and ultimately prevent disease. What's happening in the community we would consider to be sort of community transmission, and you wouldn't consider, if you will, a neighborhood an outbreak. It really is a term that is specific to institutions. Having said that, we're using the term pandemic, and that means a worldwide experience of a novel coronavirus, and that is applied to countries regardless of whether there's community or institutional or both transmission in that territory. So thank you for the question.
Thank you for that. Our next question comes to us online, and the resident asks, I've heard that most Durham Region employees are still employed. Is that true? If so, why are they still working?
Thank you for the question. I will turn that over to our CAO, Elaine.
Thank you, Chair. Yes, that is true. Many of our employees are frontline employees in essential services. So, for example, public health, long-term care facilities, managing our water treatment plants, running the transit system. So they are on the front line, and other staff are obviously providing behind-the-scenes support to those individuals. We have over 1,600 staff working from home on essential activities, and a number of staff have been redeployed to those areas that are particularly busy as a result of the pandemic, and this would include redeployment to our long-term care facilities. Where staff are unable to work from home, those are the first priority to be redeployed. There is a very small number of staff who are not redeployed, who do not have work that they can do from home, and they have either elected to take a leave of absence without pay or to use vacation time. So at this point, the region has not had to lay off staff. And again, as I said, the majority of our staff are engaged in essential services. Thank you for the question.
Thank you for that. Our next caller is Sherry, and Sherry has a question live about facilities for the region's homeless. Sherry, go ahead with your question, please.
Yes. How close is the city to providing toilets for the homeless youth in Oshawa? We have about 450 young people currently with only one place to go for bathroom facilities, which is the refuge on Court Street. The need is critical now.
Thank you, Sherry, for the question. I will ask our Commissioner of Social Services, Stella.
Yes, thank you for the question, Sherry. In Oshawa, in addition to the refuge, the backdoor mission is also open and available, which not only will have washrooms and shower facilities, but also be expanded to include on-site health support as well. And while I'm on the call, I'll also add that in Pickering, then the Dumbarton Indoor Pool will be available as of Friday. The Ajax Community Center is opening on Friday as well with washroom facilities. And in Whitby, we have the Iroquois Sports Center that's already operational. Thank you.
Thanks very much. Our next question comes live from Selwyn. Selwyn's got a question about whether or not COVID-19 is an airborne virus. Go ahead, Selwyn.
Good evening. Thanks for taking my question. Generally speaking, we have been told that COVID-19 is transmitted by person to person. But in some medical research circles, there is still some ambivalence as to the possibility of it being transmitted airborne. That being said, could you comment on the degree to which this virus can be transmitted airborne? And if it is not, then the only purpose of a mask seems to be to prevent contact when someone coughs. So I would like a little bit of further explanation on that with regard to the use of mask, physical distancing, and whether or not this virus is transmitted airborne.
Thank you. Dr. Kyle?
Or maybe Dr. McTavish could tackle this question. Pepi?
Hey, Dr. McTavish, please.
Sure, I think it's Sullen. So great question, and I think I've read the same research as you about the airborne. So I know a little bit what you're talking about, which is great. So those studies that looked at the airborne transmission were really looking at studies that, like they're making aerosolization that we wouldn't actually make in real life, right? Like the way they were projecting the droplets and the spread. So nothing we would actually encounter in day-to-day practice. Certainly there are procedures where droplets can become airborne, and that's well known, and there's good research about that, and that's why healthcare practitioners would wear a higher level of protection, personal protective equipment with those airborne procedures. But in day-to-day non-medical and not invasive procedure, out there. It is spread droplet to droplet. So when somebody sneezes on you, you touch a doorknob, you touch your mouth, you touch your eyes, and then it enters you. COVID-19 is a big molecule. It doesn't like to be airborne. It doesn't like to float around. You sneeze, it goes a couple meters, and then it drops to the ground because it's heavy. But that's a great question, and there's definitely lots of research out there. I think your second question was about masks. So when people wear non-medical masks, it's to protect everybody else from their disease. So if I had a cold and I was coughing and I was out in the community, I would wear a mask to protect everybody else from my droplets and my secretions. And then when medical people wear masks, it's to protect them from the people that they are providing care to in case they're sick. So there's two good uses for masks, but if people are wearing them out in the community, it's actually to protect others from the person that's actually wearing the mask. So hope that answered your question. Those were good.
Thanks very much for that. On the topic of PPE, our next question came to us online from Kelly. And Kelly asks, what is our current situation with PPE? Do our frontline workers have what they need?
Thank you for the call. Chief Martin, could you respond on behalf of police, please?
Thank you, Mr. Chair. Like everyone else, certainly we would like to have more in stock, but what I can say right now is that we have a pretty good level of all our personal protective equipment, and we are maintaining our stocks. You've heard much out in the media about trying to acquire more, but we are steady right now. We've got everything that we need to deploy to our staff. It depends on how much longer this goes on, but certainly we're trying to build up our stocks so that we have several weeks worth. But right now we're steady, we're in good shape, and all our people have the PPE deployed. So thank you.
And Deputy Chief Moore, can you respond on behalf of Durham Region's Paramedic Services, please?
Yes, thank you, Chair. I'll echo Chief Martin's comments that certainly there has been struggles in getting PPE, but I can say that we monitor our PPE daily, and inventories are reviewed. We are also in an almost constant contact with our suppliers and are engaged with provincial and local partners to ensure adequate ongoing supply. And certainly for the time being, and certainly for the next near future, we're in very good shape with our PPE. All our staff have all that's required. Thank you for the question.
And thank you. And finally, on behalf of Social Services, could I have Commissioner Stella, could you respond on behalf of our long-term care facilities, please?
Yes, thank you. In our long-term care facilities, the 4 facilities that we operate, we have adequate supply of personal protective equipment, and we and always have. So we have never had a problem with that. Thank you.
Thank you for those responses. A reminder to our listeners this evening, there's still time to ask questions of the Durham Regional Panel this evening. Chair Henry, senior staff, and officials from Public Health here to answer your questions about COVID-19 across the region. You can hit star 3 on your phone keypad and be put into the queue where we can hear your question live. Those of you who are participating online and listening to the audio stream, you can submit questions by typing them into the question window on your screen. Our next call is from Tom. Tom is live, and he has questions about frontline workers. Tom, please go ahead with your question. Hi, Tom. Are you there? Did you want to pose your question live of the panel?
Sorry, yes. I didn't realize I had my phone on mute. My question was, what are we doing for our police officers and frontline workers as far as protecting them? I know people still need to be arrested and stuff like that. So how does that work with physical distancing? And how are officers able to affect their job by arresting people and stuff like that during this pandemic?
Thank you for the question, Tom. Chief Martin?
Yeah, thank you, Mr. Chair, and thank you, Tom, for the question. It is a great question because obviously arresting people, you're going within that 6 feet. So it kind of relates to the last question with respect to personal protective equipment. We make sure that we have issued personal protective equipment, whether it's gloves, masks, other personal protective equipment, including hand wash and those types of things, to our officers. Unfortunately, people are still committing crimes. They still have to be arrested, and our officers have been doing a great job, both on the education front and a great job of protecting the citizens of Durham Region. I have to commend them as well, especially under these trying circumstances. But what I can assure you is that to the best of our ability, before we get to the call, we try to assess and determine what the level of risk is over and above the normal risks, but with this pandemic. And then our officers have been trained and are equipped with personal protective equipment should it be necessary to move in that close distance and take control. And so thank you very much, and take care.
Very much for that. Our next caller is Glenn. Glenn is live with us, and he has a question about information on the Durham website. Glenn, go ahead with your question, please.
Yeah, on the Durham website, it's more of a comment. I just want to thank for the transparency on the website and the update on emails. It's been very educational, so thank you for that, which leads into my question about as you do the self-testing, and let's say I have two of the symptoms. I don't, but let's just say I do, and it says to self-isolate. And let's say it gets worse. There's nothing on there, the next stage of where do I go get tested? Where, like, do you come to me? Do I go to you guys just to get checked out as it could get progressively worse? Thank you.
Thank you, Glenn, for the question. I will ask Dr. McTavish to respond, please.
Hi, Glenn. That's a great question, and we're always happy to receive feedback about the website to make it better. We update it almost daily, I would say, always trying to improve it. So certainly, if you're feeling worse, and it does lay it out on the website, and I apologize if it wasn't clearer for you. In Durham Region, what happens if you're feeling unwell and you would like to get assessed for COVID-19, you actually do that online through Lakeridge Health website. If you just go to their homepage, you'll see it. It's right on the front there, and you click through. So it's an assessment, and that's how people within Durham Region would be assessed. So you complete all the information, make sure you fill it all out, especially your phone number. And then later that day or the next day, a physician from the center calls you back. And then they determine where you need to be seen. There's a couple of actually in-person places you can be seen. Sometimes they might determine they're not the best place, but they will direct you to where you need to be. So that is how locally you would be assessed. We do recommend that if anybody is feeling unwell at all, if they're not tested, they do self-isolate at home for 14 days. Certainly people could have COVID-19 and they're not tested. So we would recommend anyone with a cough, cold, anyone not feeling well, they should certainly stay home. But that is how you get assessed in Durham Region. And I will happily take a look at the website again later tonight and see if we can make that clearer so it's easier for people like yourselves to know what to do when they're feeling unwell. So thanks very much for the comment.
Thank you for that. Our next caller is Andrew. Andrew's live with us, and he's got a question about first responders and PPE. Andrew, go ahead with your question, please.
Yes, thank you for taking my question. I know the region's daycare are open for the children of first responders. So my question is,
Looks like we lost him with that question. I'm going to go next to Joe, who is live with us. And Joe has a question about the economic impact in Durham. Joe, please go ahead with your question. Sorry, Joe, are you there?
Going to be.
Sorry, Joe, can I ask you to start your question again?
Yes. I'm wondering what Durham's financial position's going to be as we have the pandemic progressing and we have higher expenses than normal. Are we going to have a big deficit?
Hey, Joe, thank you for the question, and I will turn that question over to our CAO, Elaine.
Thank you very much. That's a very good question. We are tracking rigorously what our expenditures and revenue implications are as a result of the pandemic. And we do have a projection that takes us to the end of May that looks at possibly a loss of or a net expenditure of $14 million that was not anticipated. We do not anticipate ending the year with a deficit. We will be looking at efficiencies within our operations throughout the course of the year to try to offset the shortfall. We will also be looking at possible use of some of our reserve funds. We are now working on projections for 6 and 9 months, and we'll have more information on that likely in the coming months. Thank you for the question.
Thank you very much. Our next question came to us online, and the question is the following. I've been following the COVID tracker on your website. Are these positive numbers for Durham Region? Are we flattening the curve?
Thank you for the question. Dr. McTavish, would you like to comment on that, please?
Sure. So thank you for the question and comment. It is a great resource, so I'm glad you're following along. So I would say that, yes, we are certainly flattening the curve within the community, certainly. There's talk right now that we are actually at the peak, and it's going to be a slow descend to the other side. So the end is near. Everyone has done their part. Everyone has made sacrifices to make sure that we get the level down so we don't overwhelm our acute care resources and we do flatten that curve. Where we're not seeing flattening of the curve is in our communal and institutional settings. As you're aware from looking at our online tracker, the numbers in our long-term care and retirement homes are increasing. They're still increasing. So there's a lot of work to be done, and there's a lot of work that's happening with all of the local community hospital and LHIN players to work on this. So we need to use what we've learned from flattening the curve in the community and apply this to the institutional setting. So that is in play right now. And hopefully very soon we will start to see that in those settings, the institutional, long-term care, residential and retirement home settings, we do start to see the flattening of the curve. But please continue to check the data tracker online and watch for the flattening of the curve as it comes. Thanks for the question.
Thanks very much for that. We're coming to the end of our time together this evening. There have been so many important questions and robust conversation tonight. Chair Henry, do you have any closing thoughts to share with our audience regarding tonight's COVID-19 virtual town hall and the region's measures to protect their health and safety?
Well, thank you. And first of all, I'd like to thank you, Jody, for doing such a great job tonight. Tonight, we've heard from the residents. We hear each and every day the region is open for business. I encourage our residents to check our website for the most up-to-date information related to the COVID-19 situation. I really do want to thank all of the people that participated tonight and all the listeners. I want to thank our frontline service people that work in our hospitals and our long-term care facilities, to police, fire, and paramedics for what they do. And then I want to thank all of the people that we see but we don't normally say thank you to. I want to thank the clerks in the grocery stores, the folks that go in and keep the lights on at OPG, and the people that keep our water running and our sewers working, and the great work they do. We are all in this together. I want to thank you for staying at home and not going out into groups. You are helping us to flatten the curve, and together we are Durham strong. Have a wonderful evening.
Thanks to everyone for their participation tonight. Remember, if you had a question and we didn't get a chance to hear from you tonight, you can find updates online. In addition, a recording of tonight's town hall will be available on the region's website very shortly. For information and questions related to COVID-19, visit durham.ca. Thanks for being part of this important event. Thanks for your interest in your questions, and have a good, safe evening.